Hello, welcome to eMedley training module for nurse midwifery case log tracking. First of all, we are going to start out with the home page screen, and you'll see here you can see this is a student account as well as your name. For the purpose of training, the student's name is Test. You will click on the clinical portion, and then we're going to go to case logs. Once you're in case logs, you see the list of previous case logs have been listed that have already been logged here. Keep in mind that once logs are submitted, they automatically are approved. They may be in a draft status if you don't finish something. And then from this screen, you are also able to see who the preceptor is, the rotation, the site, chief complaint, the age of the patient, the date that you submitted this, and the ID number of the case log. If you need to go in, to change anything, you can click on this box, action, and then you can either hit edit, view, delete, link, copy. If you are doing multiple case logs, like multiple births, or multiple well checks, then it may be beneficial to copy a previous case log and update that. And I will show you how to do that in just a few moments. But let's go ahead and add our first case log. So we'll click that green add button. And here we have all of the required fields. So the date that your patient encounter, the semester that you are in, which should automatically default at the top as being scheduled. The setting type, so would likely be delivery room. Or if you were in an office doing another type of rotation or another type of setting, then you would use that setting as well. So your clinical site will default to the top as you're scheduled. Your preceptor would also default at the top of the list. And then your section, which is the course that you're currently in. If this section is blank, it is a hard stop. You need to reach out to your clinical site coordinator so they can adjust and correct that for you. But this should automatically populate here at the top. So you will hit either save, or you can hit the next button at the bottom, which will automatically save it. You will do the age of your patient. And you can do that in years, days, weeks, months, gender, race. And then if you choose, you can do the language, insurance, and referrals. These are completely optional and not required by any stretch, only for your own personal knowledge later. We'll click the next button. The type of decision making. Your student participation will always be performed. The chief complaint, we're going to log a birth and reason for visit. For births, you would put other, I believe. Yes, you would put other. Click OK. Then next. You would not need to add anything under diagnosis or procedures. You can just skip right through these by clicking the next button in the bottom right corner. However, you are required to add your clinical experiences as part of your program. So you would click add and scroll down to nurse midwifery, and then we would click a birth. So you must have 35 of these in order to graduate and complete the program. So you want to make sure that you're tracking them. If you're doing primary care, you would click primary care, interpartum, antepartum, newborn care, postpartum, whatever. And you could do more than one dependent on the situation. So we're just going to, for all intents and purposes, we're going to put birth. You are going to click performed. And then we're going to click next. If there are any notes that you feel like you want to add, if anything is remarkable, you would add that here and then click finish. And we're going to submit for approval. And we can see that our birth here is listed right here at the top, and that is automatically approved. So if we knew we were doing multiple births, we could select this on the left-hand side, click actions, copy, And then we would only need to go in and change the patient demographics. All of this would remain the same on the first page, so click Next. Maybe change the patient age, demographics, and click Next. Again, you can click through all of this if everything is the same. And then update any experiences if needed. So if you were doing something else, or perhaps you were doing something, you weren't doing a birth, you were doing postpartum instead this time, you could remove that and add a postpartum. Click Next all the way through, submit for approval. And so that's how you could do them much more expediently and not have to put all of the initial data in there. So then, once you're finished adding all of your case logs, you would click the eMedley icon in the top left corner, and that will take you back to the page. And this concludes your nurse midwifery clinical case logs tutorial.